Welcome to another episode of Return on Character Podcast with me, Dan Cooper, your host, founder and CEO of Rock Investments, an investment strategy that allocates capital into the public markets based on the character of the leadership of those companies. I am honored to have with us today Renee Dua, CEO and founder of Rene, a company that I'm excited to learn about because I think it's pretty unique. And I have a feeling the origin story is pretty special as well. Thank you so much for coming on, Renee. I appreciate your
My
time.
pleasure. Thank you so much for including me.
Yeah, Renee, as context for what you're doing today, tell us your story. Tell us about how you got started in business. And I know I should actually call you Dr. Duo, right? Instead of just Mrs. Dua or Renee Dua. You're a practitioner as well. How'd you get to where you are today?
Yeah, so it's true. I am a doctor, though nobody calls me Dr. Dua for what it's worth.
Uh-huh.
Um, about, I'd say 20 years ago, I finished medical school and I opted to become a kidney doctor. My father's a kidney doctor. My mother is a general medicine doctor, a family medicine doctor. Neither of them wanted me to be a doctor altogether. They wanted me to be a teacher. But
Why?
well, it's a hard life. You know, being a physician is a hard life, and especially my mom who came here from India. They both came here from India, but my mother and father, when they came here, there was no internet or cell phone, right? They didn't,
Mhm.
they were a part of a very different culture, religion, community. And then on top of it, they went into private practice. So they were running a business after redoing a bunch of their training again. And so it really, it really sort of whipped them into shape. That's not to say that they didn't make enormous successes of themselves, but there was a lot of hard work and there was a lot of sacrifice. And I think they didn't want that for me. They didn't want me to necessarily deal with the things that they had to deal with. But I mean, it was sort of in my blood, and I went to when you decide you want to be a doctor, I was just volunteering at my boys' school before I joined our podcast. And, I met two little girls who want to grow up and be pediatricians. And
Yeah,
that's when it
sure.
starts at 8 and 9 years old, that you realize, you want to dedicate your life to this calling. And when you do that, you have to be a great student forever, right? There are no B's, there are tons of activities and lots of studying. And so when I finished medical school and I decided to do a residency and fellowship to become a kidney doctor, I did it not just because my father had done it and I had a sort of in, but because truthfully, I loved it. I loved the practice
Hey,
of kidney medicine specifically because it is a kidney disease affects the underserved, really affects people who are underprivileged, who do not have necessarily access to care. And I happened to be fluent in Spanish, right? I still am all these years later. And I happen to love taking care of people who are just so full of gratitude and, respect. I mean, I cannot say enough about the community of patients I take care of. I will never stop practicing medicine thanks to them, right? Through all the interesting things I've done with my life. When I started practicing, and I opted to go into private practice, which nobody does anymore. But when I started practicing and I put up my shingle to start my practice, I was the only woman who spoke
shoot.
fluent, who spoke, read and wrote Spanish in my entire community, which incidentally is a huge place. I'm from the San Fernando Valley in Los Angeles, which is enormous.
Wow.
And I was the only woman, first of all, at full stop. And then I happen to be fluent in Spanish. And that, the San Fernando Valley is predominantly Hispanic and Latin. And so I
Mhm.
became very busy very, very quickly. And there were points in my career where, I had an office and the line of the patients who were trying to see me they would line up in the parking lot. I would upset all the
Oh
parking lot
my word.
attendants because there was no room in my waiting room, and there was no place for them to stand, and it was busy. So I very much enjoyed providing this service and this type of medicine to my community. And I became so busy that I kind of neglected the other part of my life, which was finding a partner and, making a family. And my parents were giving me enormous pressure, which is what Asian parents do generally. And
After you get the degree, you got
that
to
means
check the
nothing to
rest of the
them.
box.
That should have already happened.
Oh, really?
Yeah, you don't get any credit for that. Um, and I met my now husband, and he is a serial entrepreneur. And he saw what I was doing, and he said, you are, first of all, insanely busy. It's too much, right? You cannot possibly be a good wife, a good mother, and a good doctor with all of this. It's not practical nor possible. Someone's going to suffer,
Yeah.
which, I didn't want. And separately, he said, have you ever thought about, and I had started a business, obviously, but he said, have you ever thought about how many more people you could help if you started thinking about how software could help your patients? And, the truth is, I had already worked with some software. I was also the first doctor in my community to install an electronic medical record system.
Oh
Not
my
to age
gosh.
myself, but, that
Wow.
no one in my community was doing these things. So I had, learned a lot of different software types, EMRs, QuickBooks, trying to make an office paperless and wireless and faxless. 20 years ago, that was not a small feat, right? Everyone thought I
Mhm.
was crazy. Um, but I had been doing that. And when I met Nick and he asked me to consider using software to improve patient outcomes, I had to really do a heart to heart to think, I am a little bit of a tech savvy person, but am I capable of scaling a business through software? And I kind of blew him off for a while. I ignored him for a while, and I kept being very busy and seeing my patients. And then we started to make a family, which for us was disastrous. It was, plagued with infertility and loss, and it was just an awful
Dang
experience. And more terribly, and I'm ashamed to say, it was really a letdown by my own people. I had doctors letting me down left and right,
it.
malpractice, and it was just terrible. It was a terrible experience. And when we finally started to have some success in the department of having children, we had constant complications. All of my children were born in NICUs. I nearly died. The anesthesia didn't work. You name it, I had the problem, right? And it went on and on. I'm leaving half of it off the podcast, right? I don't want to ruin anyone's. But I one night had to take one of my sons to an emergency room because a physician at 5 o'clock on Friday told me, I'm closed. Sorry, I can't help you. Right. So I took my son to an ER. He had very high fever. I was freaking out. And we waited about 8 hours to see a
Jeez.
doctor, which is absurd in Los Angeles. And when I finally saw the doctor, who happened to be a friend, he said, Renee, you are a doctor. What are you doing here? Right? You know medicine. Why would you wait here? And I said, well, look, I want to be a mom. I don't want to be a doctor. And I don't want to miss something on my newborn who's a preemie, who's, sick, right? I don't want to do that. So in the end, on the way home, I turned to Nick and I said, here's what I'm willing to do, right? I'm willing to have you build me an app. Nick is an engineer. And I want to turn on and off like an Uber driver. And I want you to be my medical assistant. And we will see patients in our community, right? I'll do house calls. And that way, because I can turn on and off, I will be able to dedicate time to our family and appropriate time with our patients, and I won't stress out so much. And that's actually a hilarious story because I thought I was very stressed when I had that made that decision to go into software. That company turned into Heal, which spanned 13 states, 300,000 house calls, in network with more than 25 insurance companies, had
Oh
$200
my
million
gosh.
in venture capital. We grew it into something wonderful. We had, this was 8 years ago now. We had one-touch telemedicine. We had remote monitoring devices. We were seeing children, seniors. We were delivering on, this notion of value-based care. It was a wonderful, wonderful company that is now being acquired actually by Humana, a Medicare Advantage plan. So that's the sort of the very long story of
But you
how
were way ahead of the curve there.
way ahead of its time, Heel, way ahead of its time. Very difficult to fund, very difficult to get, people to invest in, because rich people already have their doctor on speed dial doing house calls. Why should everybody have it, right? So very, very ahead of its time. In the last 2 years after that experience, I left to start something new with Nick. He named the company Rene. I'm strategy officer, and Renee is a health assistant. No, nothing but software, not a medical practice. I don't have doctors working for me, and we're not delivering house calls. So a very different experience this time.
Well, I mean, one of the things that strikes me hearing the story um, is that, I mean, it almost sounds, and I got to use the right language here, but it almost sounds like you're working in a developing country in your experiences.
It really, I'm
Like
embarrassed to
you,
tell you that you're right.
yeah. I mean, but the truth is this is the hard reality of of a lot of American medical medicine, right?
It really is.
And my wife, she is um, a PA, and she has her public health degree, and she works with the poorest of the poor in our neighborhood, and all the homeless and everything, and that's what she does. And it takes a unique human being to want to work in that arena of healthcare. Um, how did you get to the point where you felt like that was, the arena you wanted to play in? Because it's not it is not an easy thing. Not only from the standpoint of just providing care, but just seeing circumstances that weigh really, really heavily on you in a disproportionate rate than, say, maybe other populations. How did you get into that? In the early days, do you recall how it was
Yeah.
that was the direction you were pulled?
Yeah. Well, the first thing I have to do is give credit to my parents who, when they come from India, which is a different kind of poverty, right? And
Right,
they gave me the privilege of getting to see how people in India lived back then. It's much better now.
right.
But when I was a little girl, I was exposed to children begging for food, right?
Yes.
With no clothes and no money. And it imprinted, right, for me. The second part of this is I had the privilege of getting into county hospitals for my training. I am fully county trained. Every residency, fellowship was all done in Los Angeles's county hospitals.
Right.
UCLA has a county arm, which I spent a ton of time at. USC is where I did my fellowship. I had gotten so much experience in 6 months at USC. I could have been a full-fledged nephrologist, right? Just, I didn't need to do 2 or 3 years. And when you do take care of, and when you are willing to expose yourself to the haves and the have-nots, what you really recognize is life is made by to whom you're born and where, right?
Dave.
I cannot say enough about how much privilege I have and how much my parents did for me and how important it was for me to turn around and give back. It's a part of my self-worth, right? I grew
Dave.
up with the kind of dad who would see someone pass out at a gas station and drive them to the ER. And I have those distinct memories, right? And there
Right.
was no way I could have been anything else because I saw that a real doctor, in some cases, in my parents' case, put their patients ahead of their children, right? Good or bad, that's who they were. And as I've grown up and I continue to grow in the world of medicine and to see, honestly, not to sound like a negative Nelly, but what a disgrace it's become, right?
Right.
It's been very important to me that the people who are suffering get some access to care. That was the entire mission of Heal, was to deliver access, right? So
Do you think it's improved? I mean, was Heal targeting the people that didn't have the access
we
generally?
started with the people who did, so we could get to the people who didn't. And as I
I
left that
understand.
company, yeah, you have to
Yeah.
make money when you take venture capital, right? But as I
Yep.
left that company, we were operating in Louisiana, in North Carolina, South Carolina, Georgia, right? Parts of New Jersey, Southeast LA, all over the Bay Area. You know, I have done house calls in heroin dens. I have done house calls in Bel Air, right? But the idea was you should not have to struggle to find a doctor who spends time with you and sorts out, you know, what your healthcare needs are, right?
Right. Right. Well, so you're no longer with that organization. I'm assuming you said, right?
Yes, yeah, it's been acquired. Yeah.
Since you launched Renee. What was the impetus for Renee? Why did you do this all over again? What was the point? You already did something. You
Yes.
should just retire. You
I
should be with the
I
kids
I
at
should
the
think about
school
retiring.
working.
Yeah. Well, I like to be busy, right? I'm a busybody. I
Yeah.
like to keep very, very active and busy. So that's maybe a problem, right? But two, during this whole, first of all, as I was building Heal, I had multiple children, right? And I became a
Wow.
caregiver for those children. Additionally, I had parents who were aging, and I am their primary caregiver. And when I talked, you know, my mother is calling me right now, and it's going to be, Renee, I have an appointment on Friday. Can you take me? Right? Or my dad is going to say, Renee, I can't remember why I take this medication, or I need a refill, right? Mind you, my parents are both doctors, but
Right.
still, the business of caregiving never stops. And it's an enormous responsibility. Lucky for me, I'm a doctor. I know how to caregive a little differently for my children and our parents. But I also think I know there are millions of people here in the United States that are caregivers with no training. They are almost community health
100%.
workers, right? They have no support.
Mm-hmm.
They're not being paid for the work they're doing. They're doing kind of silly tests. Sitting on the phone with the pharmacy for 40 minutes to get a refill is absurd, right?
Totally. Totally
Total
happens
waste of
all the time.
time.
And it's the kids, lots of times it's the kids that end up having to take that on. And
Absolutely.
it's a totally new dimension and they have no
Absolutely.
idea what they're doing. Yeah.
Absolutely. And so, you know, women who do take this on a lot, we know this because they left the workforce during COVID. Women are the chief medical officer of the house, right? And I wanted to use, now that we have, you know, this incredible world of artificial intelligence, I wanted to use AI to create a health assistant. And so Renee, which is, Nick called it Renee, is a health assistant that uses AI to do simple tasks, remind you to take your medications, make sure your refills are picked up and, you know, delivered, make sure your appointments are rescheduled, organizes a ride if you need it, right? All through generative AI. And of course, this idea is an enormous undertaking and it's very software heavy. But to me, as we're all getting older, we're not, I'm worried who's going to care for us, who's going to certainly care for my children, right? As we're a part of this sandwich generation. And so it's going to be software that solves a lot of these problems.
Is it, is, so that's, so you're in the mix of launching that now, or is it available? Can people
It will launch
download
in
the
the
app?
next month. Yeah, it will launch in the next month. Yeah.
Because my brother-in-law is dealing with the exact same thing. He's
Yes.
got an elderly parent, and you know, of course, they can't afford to put him in a fancy nursing home, and so all the responsibilities is falling on the kids, and it sounds like a very very unique and needed tool. You know, in relation to your business experiences, you know, what, or even personal, what do you think was one of the more defining character moments of your life that that has defined you to this day? And maybe we already covered it, but I'm just curious.
There have been many, but one of the most important we did cover, which was the opportunity to travel around the world
Yeah.
and see how people live, right? My parents were very good about taking us internationally, taking us to India. I've practiced medicine in Africa. I have been to places, like South America or Central America and been able to see how people live. And I mean, I've been in Australia in the bush, right? On the plane that, delivers the medical care to the people who are living so far from any hospital or market or anything. I've really been again, privileged and blessed to see how our neighbors around the world access medical care or don't, how they live, their children grow up scrappy or not, how their children
Damn it.
survive. I mean, one of the things that is always interesting is here in the United States, we're able to say no to vaccines. We're able to say no to milk, right? We want almond milk. We want soy milk, right? We do these things, right? When you go to, Lamu in Kenya, which is a tiny little village, and you see how desperate they are for syringes, right? Forget vaccines, forget milk for a moment. I mean, it's again, it really colors you in ways that I think about, I don't know, once a day at least. And then I think the second thing I'd say is becoming a mother, because I've always been a compassionate person. You have to be a doctor. But becoming a mother led me to understand compassion very differently, especially being a
Hey,
mother, has lost a lot. And I feel for my patients and their loved ones more than I can, spend the time on for a podcast, right? I think about
yeah, I mean,
their
you've
success
gone
and
through it.
survival. Yeah.
Yeah, and I mean, I can relate too, as my wife and I struggled with infertility and all that, and it's utterly brutal. Much less having complications afterwards. Um, I would be curious from the perspective of a woman treating patients in these challenging environments, and your knowledge of the American healthcare system. What would be the things that you would like to see changed, or what are the more innovative solutions you think are out there that we need to pay more attention to?
Yeah. So what I'd like to see changed is the amount of greed in healthcare, right?
Okay.
There is enormous greed in healthcare. And when you're looking at insurance companies raking in billions of dollars and Americans living less long, that's a joke, right? Something
Right.
is not aligned there. And the folks that work in, the executive suites of these insurance companies, they're doctors on speed dial. These are the haves. They're going to get access to any care, no matter how, challenging, whatever transplant, whatever chemo, whatever infusion, they're going to get it without a prior authorization, without any BS, without any nonsense. Whereas millions of people who do not speak the language, who do not have the education, who do not have the understanding, who have no idea what their insurance actually covers, which is nothing, right? In some cases, are going to suffer. And so are their loved ones, right? And we're not just talking about, older people. We're talking about children. We're talking about children who are caregivers. We're talking about mothers who make babies, right? We're talking about people who are managers at a store that, provides all the pharmacy, the pharmacy for the community, right? You cannot imagine how important each life is and its success and the importance that that life has the opportunity to go on, right, and succeed. So that is what I would change, hands down, right? A reflection on how to actually deliver accessible care and maybe lose a little bit of money one year. It's okay, right? Everything's going to work out. And then
Would that frustration also be within the for-profit
100%.
hospital care
Yes,
just as
absolutely.
much as the insurance? Yeah.
Absolutely. And the hospital business is having its reckoning, right? The hospital is not a place where you can stay very long anymore. There's all kinds of software coming
Sure.
around for hospital at home. The hospitals are getting penalized by Medicare left and right, again, because they've taken advantage for a very long time, right? And also I assume their lobbies are not as powerful as the health insurance lobbying is, right? But I
Sure.
think innovation, billions of dollars were poured into health tech during the pandemic. There's almost been no innovation that has improved healthcare outcomes. Hopefully, some of the money that went into mental health will have some improvements. There's been a lot of, what we call pill mills, where you get on the phone with a doctor and he prescribes you Viagra or something for your, male pattern hair loss. I don't find that particularly innovative, right? But it exists. I happen to be ahead of the pandemic, very innovative in delivering care to the home, for which I'm a
Right.
huge believer. But it is very expensive to deliver care to the home, and the insurance companies have to be willing to cover it and pay for it and recognize how important it is that people don't have to go to an office setting to get excellent care. So I think there are some innovations, but right now, especially as our market is having its, the market is having its own reckoning, it's hard to be very, very positive about healthcare at the moment.
Yeah. Yeah. Well, it's a pretty discouraging system, and it's been hard to watch some friends having to go through and
Yes.
manage it. It's almost like the legal system, and I mean, it's so intimate and it has such huge outcomes on people's lives and the
Yes.
trajectory of not just them but their families.
Yes.
And that's an emotional topic too, which makes it even more difficult,
Yes.
to deal with. Well, it's been a pleasure speaking with you. Tell us about how we can learn about Renee, and if there's somebody out there that resonates with this need, how do they get on the front end of being
Sure.
able to utilize what you're developing?
Sure. So you can find us at renee.com, renee.com. Our
Mm-hmm.
product goes live on May 1. So, and I'd love
Neat.
to have users and I'd love to get feedback. So if you do use it and you do want to reach out to me, my email is renee@renee.com. And I'd love to hear what you think.
Oh, that's terrific.
It will be
Well, I
free,
already have.
incidentally. It will be completely free.
Really?
Yes. So I think that's
Okay.
pretty awesome too.
That's pretty amazing. I have my brother-in-law, and he will be signing up on May
Awesome.
1
I'm
then.
glad to hear it.
Thank you so much for your time. And most of all, honestly, I just, want to thank you for your passion for going after some of the more difficult challenges in the world. I mean, this is, I know a lot of folks like you, and I know the toll it takes, both internally and externally. And I really appreciate what you're doing.
I
So
really
keep it up.
appreciate it. Thank you so much. Thanks.
All right.